Hey guys, I'm Dr. Ross, and I just wanted to take a couple minutes and show you some things that I think are really important if you are thinking about getting dental implants. Dental implants are a big decision. They're a lifelong decision, and there is a big range in outcomes in which those dental implants can be done. And we want to show you why some technology that we have invested in over the last few years has greatly increased our success in accuracy, quality, and why I think that you could benefit from that. It's allowed us now to plan the case holistically and with the patient's entire face implant, essentially. For example, we now have the ability to both 3D scan the skin and the face and the smile on a patient. And then with that information, we know so much about where is that smile going to end up being. When we have this information, we can actually go and plan teeth that are appropriate in a patient's face. We can turn on and off different layers from bone to teeth to skin and see, okay, does this patient's teeth fit this patient's face? And once we know the positioning of the teeth where we ultimately want them to be, we can go through and we can plan implants in a three-dimensional fashion, respecting all the important anatomy. This case, for example, allows us to pull back and say, okay, we want the teeth here and we want the implants here. And once we know that information, we can plan surgical guides that help guide our implants exactly where they need to be. So I just wanted to show you a little bit about these surgical guides that we're designing. Let's say a patient wanted to have an implant placed in this missing tooth space here. You know, the old school way of doing it is really just going in free-handed and trying to make sure that you're straight right between the teeth, which for many is not a hard task, but why not, like I said, make it a little bit more predictable with these 3D printed surgical guides that can snap onto the teeth and essentially give us a cylinder that we can place the implant through, and it can control our angulation and control the depth so that we know that we're not going to be anywhere near where we don't want to be when we place implants. We can take that a step further where we can have guides that can plan our implants in a predictable fashion by snapping this on and guiding multiple implants exactly where they need to be inside of the patient's mouth, so that ultimately we can respect the vital structures and we can have them in the right spot for the final teeth. And I think that's the critical area. And so that's what we're so passionate about here. This new technology has allowed us to deliver that kind of care. We hope that this is here to stay and that this is the wave of the future as far as implant planning, implant placement, and getting new teeth for patients. So we're really, really excited about it.